Welcome to Integrated Health Services Dental to Medical tutorial. I want to run through from the beginning to the end so that you can see exactly how to get through this program. Once you're used to it, it'll probably take you 5 to 7 minutes per patient. The patient does not need to be here for most of this. When you first log in, you'll enter this screen. In this case, we're going to send the medical health questionnaire to a patient. This is how you know it's been sent. It'll tell you. The patient will receive it, and I always recommend call the patient, make sure it didn't go to their junk or whatever. Advise the patient they're to fill the medical health questionnaire out online. At the bottom of each page, hit save. Once they finish, hit save and submit, and it will be stored on Portico. It never comes off Portico. We're not moving information. We're simply giving them access to the portal in a very HIPAA secured manner. Once they've sent it back, first thing that will happen is when they send it back, we'll know it first at Integrated Health Services. And you will receive a secured email of the patient's benefits. The password will always be your Portico login. And you'll be able to see what benefits you're working with before the patient ever comes into the office. You'll then go to the patient workup when you log in, and we'll use an existing patient just because it makes it easier. I don't have to go through and fill all this in. The first page that you'll find is this. You'll have to type in the subscriber's ID, the group number, because inevitably they'll switch them. They'll also put their last name where the first name belongs. They'll put their phone number instead of the insurance verification number. It will be very wise to also make copies of the front and back of their insurance ID card, their major medical, and in fact their driver's license, because very often we're asked, what's the patient's address? And make sure all that information's in here, then hit saved. The next stage will be the dentist. You'll be able to select the dentist. In that case, it's only me in there, so it went directly to me. But in case there's another dentist, just put their last name and select. Now you go to the questions. These will be all false. If one of these is true, then there may be indication that it will be covered. And I'll ask you questions like, is your current dental condition the result of an accident? If that's true, we need details. That may be a slip and fall, that may be playing around the house, it may be a car accident, whatever. There may or may not be a police report, but we need the date and how it's going to be connected. And we'll have that down the line. Do you experience joint pain in the jaw? There's going to be questions about metastasis. When it asks for infections, it's not talking about periodontitis. It's speaking of another fulminating infection that's starting outside of the gums and the teeth and is now affecting them. If the patient has been diagnosed with sleep apnea, we want to know that. And if they haven't, it's okay, maybe we're doing sleep apnea on them. But if even one of these is true, then they may have indication, and you'll see now this is green. You'll then be taken to tab number 4, which are the guidelines. You're going to pick from implants, because right now we start everybody with the implants and the orthodontic because it'll give them practice on how to do it right. If we give you too many options, the front office is not going to be able to keep up. And they're going to ask you questions in terms of malocclusion and true or false as indicated. Conservative care, failed conservative care once documented, and Are you taking any home therapies, any so malocclusion, functional deficit, and failed conservative care? Now, this is very important. Medically, we're going to look at the mouth in quadrants. Quadrant 1, 2, 3, 4. If you have 4 or more missing teeth in a quadrant, that entire area, so if it's in a maxilla, then the entire maxilla is going to be considered completely edentulous. If you have less than 4 in a quadrant, so if you have 2 in one quadrant, 2 in the next, it's still considered partial. This is a code for it, and this is just to help you later when it comes time to choose the code. If you answer true on this, then that's going to be a partial, and that's the code 21248. Just to get through this, I'm going to run through it. If you have 4 or more, it's going to be 21249. You can have 2 units. So if the maxilla and the mandible are both complete, you'll have 2 units of 21249. If one has complete, one partial, you'll have 1 unit of each. If both are partial, you have 2 units of 21248. Make sure you submit it. The next thing is it will take you to tab number 5 where you choose a diagnosis. So what we're going to choose is generally you're going to choose one M27 code. Almost every patient will have alveolitis, and you're going to do an M26 code. And for this, we're going to look at a more explicit one. Let's say Engels 3. And this area, you cannot just bypass it. It will not turn the tab green. We don't want this paper whip. You'll be, you're responsible for that, for the accuracy of this, and this will go on the letter of medical necessity. So for instance here, where it says 21247, it's not going to be 21247. It's going to be possibly 8 and 9. And make sure the description is right, because generally with these, you're not going to be using, some of you will if you're trained to. Most of you are not going to be using saws, and it's somewhere in here it asks you about that. You're able to amend this right here. Saws, drills, osteotomes. If you're not going to use that, then just erase that part. Make this as accurate as possible. We have it pre-populated to help you with the structure and the verbiage. Now it's going to take you to the secondary. And for this case, what you can do is definitely is where you'll do the K codes, K0. And you'll see that when I press in K0, things like periodontitis, embedded teeth, impacted teeth, radicular cyst, all this edentulisms, class 1, 2, 3, 4, all that comes into play. Also, you'll have the generic malocclusion, which you generally want to M26.4. Then you'll hit save. It'll then take you to the primary CPT codes. Now this is important. Let's say if we're doing an all on 4. All on 4. Now remember when we looked at 1 or 2 units of 21249. So let's say we're going to do 1 of each. All right. Actually, let's say we're going to do. This is very important. You may say, what happened to 21248? If you don't see it in here, then probably with this guideline, Aetna, they only want 21249. Okay, here's where you do 2 units. Notice it doubled the price or the reimbursement. If you're doing grafts, if you're doing any arthroplasty, any osteotomies, that fit that guideline, I should stress. So if you're going to do anesthesia in-house, this is coded for you doing for a separate person who's not doing the actual procedure to do the anesthesia. Okay, if you're going to do it yourself, which as far as we know none of our offices are doing, you don't have the oral surgeon or dentist who's doing the procedure also doing the anesthesia, him or herself. But if you did, then it'd be a 9 code. So what you're going to find is over here, what you're going to find is if there's an asterisk and you're doing bilateral or upper and lower, you can actually do 2 units. That's what the asterisk indicates. And so what you'll see, and since I didn't put in a real insurer, it's going to generalize. If this is Medicare, which is in blue, you'd be paid $4,100 for this. If this were usual and customary, you'd get paid $27,000. Yeah, slight difference. It's not always that type of difference, but for this, it happens to be. For this, let me say this: Medicare will actually be more than $4,100. I didn't put the prices in for here. I can tell you Medicare is going to be about $9,000 for this. So we'll hit save, and here's where we go for any secondary CPT codes, procedural codes, for your extended exams, whatever exams. And I would tell you hit 99 here, and if you hit 992s, it'll have all the referred patient, established patient, detailed exam, all this stuff. These are secondary. They don't pay a lot, but it's extra money and it's accurate in regards to what you're doing. Then of course we're going to hit save here. Now this will be something that you guys are very familiar with. This is where you're going to put the number and location of the missing teeth, the interarch distance, the number, type, and location of the implants to be placed, the existing and proposed occlusal scheme, and the design and type of planned restoration. This will appear on the letter of medical necessity. Okay? That's very important. Now, if you're just doing some procedure that this has nothing to do with, we will allow you to skip this. Now, what documentation is needed? Okay, and this goes through and it'll tell you what do we need. Here's where you put your the patient's medical card, all the other things. I'm not going to read through those. If there's something like there's no referring physician in this case, we can hit ignore. All right, I'm going to do it on all of them just so I don't have to load them. Now, particularly with the films, some of you will have 10, 15 films. You don't have to add those here. You simply add those here. We want the name of the file, but also the view. This is very important. Then you upload it from your computer. It didn't like the fact. Here we go. Ignore it right here. All right, that has to turn green. From this point, we can immediately do a letter of medical necessity. Now, the reason the LMN is in block form here, there's certain things that we don't want you guys to be able to change, and other things we do. Now, what we found is if we just give it to you guys straight in Word format here, that the font will be off. It'll be a mess. So this is more to contain some of the docs or the office staff or whomever's doing this, so that they can't mess it up too badly. Now, if you want to know how it's going to look in its final form, you simply hit download LMN, and you'll see that when it comes up, it will come up in a text document. In this case, and mine is coming up in Word. So you see it comes up, and it's a very robust letter of medical necessity. It's going to have all this verbiage that we caught earlier. If we would have put in all the missing teeth, the occlusal scheme, you see where we changed the to 21248, 21249, and all this stuff. This is all the quadrants that are missing and so forth, because it now justifies the coding, right? It's going to have the diagnostic codes, right? The alveolitis and other things we were talking about, and it's going to explain how they're all correlated, how they're all the justification. Now, you can adjust it here, or you can, but what I will say, if we want it stored in the system, then we need to make the changes here. Now, I will say, since the LMN has to be signed, I'm going to show you the easiest way to sign it. All right. So the easiest way to sign this is going to be through PDF. So what I'm going to do is I'm going to simply save it as a PDF. The goal is to never have to, and we're going to call it LMN3. We'll call it LMN3. You see I've done this a lot. All right. So let's go here. Let's actually put it on my desktop here. And you'll see we'll replace that one with this. And so what happens is when we go to open it up, here we go. So it's converting it in Adobe. We want to do it in Adobe, so we have it here in text because it makes it easier just for you to be able to change or manipulate or to do whatever you want to it at this point. However, Adobe will allow us to do more things in terms of security. All right, something very important, right? So here's where we have it. In if you don't have Acrobat, Adobe Acrobat DC, I would suggest you get it. It's probably $10–20, something like that, maybe a month. If it's even monthly, it's probably $50–60 a year. It's negligible. I didn't even notice it. But what you're going to do is you're going to simply fill and sign. Once you do here, you're going to simply come up here. Did I hit fill and sign? Yeah. My system's slow, so it's just processing. Okay, so we're simply going to hit the signature here. Oops, sorry, I'm all thumbs here. And it is going to bring up my signature. I'm simply going to bring it right here. And see, it's very clean. I never had to print it out, never had to do anything. I can close that right here. And we have a fully signed element without ever having to take it off. Now I will say something that you won't have to do right now, but if you ever have to send it through the email, you come to File, you come to Properties, and you simply go to Security and you lock the file. Okay? Require a password to open it and put your login to Portico here. Okay? We can restrict the editing. However, if you're going to send it to me and we need to send it out to bill it and so forth, doesn't make sense to do that. Well, you can do here. You can lock it so no changes are allowed, but allow me to print it. I'm going to need to print it. Okay, but that's something I like about this. So what you're going to then do is you're going to go back to Portico, because remember you're going to save that PDF, and you're simply, this is where we go to the files. You're going to upload that PDF and you're going to title it Signed LMN. Any changes you want to do, if you want them in the system, you're going to have to replicate that here. All right, this is how we maintain the integrity of the formatting. And you have to hit approve. All right, now the reason it says please submit the patient encounter when everything is ready, remember if we haven't already uploaded the signed LMN, we can go back and do it right there. All right, if you didn't have all the films right there but wanted to proceed, you go and make sure you uploaded all the films. But you'll have to hit submit encounter. Now, when you hit it, now you see where it says submitted pre-authorization. This is the one we just did. And it's going to be there until it's either approved or rejected. Now what I'll do on mine is I'll go through and, well, I'll show you what I'll do. So on my side, I'm going to go in and I'll pull it up from my corporate queue and I'll be able to review it. I'll be able to review everything that you've done and make sure everything is right. The MPI is there, tax IDs, everything we need is going to be there. Make sure that we have proper ICD-10s. We have the M27, M26 codes. Why M27 and 6? Because some policies want 26, some want M27, and you don't know until you submit it to prior authorization. So The goal is not to have to redo our work. I'll be able to see the procedural codes, and definitely I'll send you a message and say, hey, check that 21249, or check that, or particularly if it's 21247. I'm like, are you doing endosteel? All right, then you need to update that. I'll be able to make sure you didn't, like I bypassed all the uploaded files so you don't have anything here. Here's where all the files would be. If I see this, I'll kick it back and I'll say, hey, you have to upload some files. If I need to send a message to you, I'll send it right there and you'll get it on your screen. And this is where I can look if I had verified the insurance. Here's where I would know all the insurance information. For instance, MNRP, that pays at about $150 Medicare. MRC1 is Medicare, reasonable and customary. Patient has an HSA, HR, we'll have all that information. But what happens is from here, we'll send out for prior authorization. We'll take the whole file and we'll send it out. Once we receive one way or the other, if we receive a pre-authorization, I'll have a pre-auth number in there, and we'll put it here. If it's a denial, we'll find out why they denied, and we'll send you a message. And if it's something we can't overcome, we'll tell you it's denied. That policy just will not allow, will not cover this. And they'd know that before. They didn't tell us, or only an oral surgeon or a medical doctor can do it, or whatever. That happens, for instance, with Cigna 20 to 30% of the time at least. Okay, Cigna, you won't know. They'll say, hey, it's medically necessary. However, we don't let dentists do this procedure. It has to be somebody with an MD or DO. And some of the policies will be like that. And unless we have the patient's plan documents, we would never know. Okay, so once I hit prior authorization, we're going to go back to your screen. And you see, when we go back to your screen, what we'll do is we've just approved it, and it'll come through. I'll have to want me to, yeah. See, I just had to refresh. So now we go to that approved one, and we're good to go. The procedures have been approved. All we have to do is do the procedure. Call the patient in. Hey, we're good to go. We'll go and do the procedure. Once we've done the procedure, all the information is already in. OpNote is just like the letter of medical necessity. All right. OpNotes is full with the descriptions, patient's history, health history, allergies, everything, the procedures, indications for procedures, procedures in detail, all the other information that we've put in. You can amend this here if there are any complications or what have you. Okay, so, and it'll be the same thing with this. You can download this if you please, because keep in mind, you're going to have to sign that OpNote. And let's see, I guess we'll use Western for this. I think we use Western, yeah, Western European Windows. And here's operative note. Full, robust OpNote. How fast was that? It's going to have the preoperative, postoperative. It's going to have the CPT codes, all the descriptions of what you've done in detail. You can read through there and make sure it's accurate. So we're going to do the same thing as we did with the LMN. We're going to simply save it as a PDF, and we're going to go to sign. We're going to sign it without ever having to download it. And once we sign it, we save it. Once we save it, we go to back to our screen. And first, in this screen, very important, you're going to upload it. Actually, all right. So in this case, with the op report, you're not going to upload. What you're going to do is I already told you how to put a password on it. You're simply going to email it to us. Why? Just because it doesn't give us the ability right here to do it, and we may amend that so that you can upload the OpNote. But in the meantime, as soon as you hit approve, it's going to be billed. We know we're good to go. Your operative notes have been completed and the record submitted to Portico. It gets billed out from there, and we'll keep you updated with it being paid. We'll know first because electronically it'll tell us that it's going to be paid. Then what will happen is they'll actually mail the check to you unless you have an EFT set up. And once you get it, we reconcile what they said they're going to pay to make sure that's what you've received. Right? You don't want to pay based on what they said they're going to pay, and then they've done some type of recoup or set aside or what have you, and you actually didn't get that money. So we reconcile with what you actually received with what they said they were going to send. Okay? So it's really that easy. It's very easy to do this. Of course, it took longer because I explained through it, but the reality is when we go to a patient and we're looking at this, the patient may be there for these two, unless you know, once you get adept at this, and they don't need to be. You know to ask them the question, right? The patient will come in, and the front office will say, Mr. Smith, have you been diagnosed with any other conditions? Do you have problems opening the jaw, closing the jaw, jaw pain, jaw clicking? Have you been diagnosed with sleep apnea? Do you have any problems sleeping? Okay, they'll ask them those questions before the patient even comes back, and you'll know if all those questions are no, don't even bother with this because they're not going to get covered. Is there a trauma? Okay, so we can get the crowns, we can get everything covered. Okay, then so only on these two. The patient doesn't need to be here for any of this. And so, as a dentist, it'll only slow you down. It won't even slow you down. The office staff can do the rest of this. So we've made it very, very simple, very easy. Now, Portico is a newer system. We had been doing this manually, but it was just too overwhelming. All right. So what you're seeing now is the first of its kind. It has all the policy guidelines, everything that you're going to need. Question is, what happens when we get insurance and that insurance doesn't have a guideline on here? Well, keep in mind, when the patient sends a medical health questionnaire, we'll know it. Probably be at least a day or two before they come in the office, if not more. It'll be there by the time you need it. Okay? We get it first. By the time they come in there, it'll be there. All right? If you have any other questions, you'll have our contact information for our help, and we'll put a button up here, and it's in some of the logins. This is a sample login, so you don't see it here, but in the regular logins it'll say support. You simply hit support, you fill out the problem, it goes directly to our IT, to our Chief Technology Officer, and to me. So it goes 3 places. It won't be ignored, and we'll get on it ASAP. Very often, any problems that come up can be resolved in 5 minutes or so, maybe 5 or 10 minutes. Sometimes the kind of problems you have is maybe you forgot part of it, and this is going to happen all the time, where docs will say it won't let me do the LMN, and they'll neglect to see that this is still yellow because you didn't amend this. You walked right through it. You didn't even look at it. So I'll say go back and you have to fill that out. Or maybe you didn't add anything on or you mishit and ignore on one of the files here. So now it won't turn green. Maybe it's a problem. It's a system problem on our end. Maybe it's a server issue. Maybe we are on Microsoft Azure. Could be an Azure issue. Could be in the middle of an update. Hopefully not, but who knows? If they're doing it at night and you're working at 1 a.m., maybe it can be. But if you hit the button here that'll say support, it'll go right to us. If you have any other questions, each one of you will have a welcome package with our information, so you can just ask us directly. I hope this was beneficial to you.